بسم الله الرحمن الرحيم اللهم صل على سيدنا محمد وعلى آل سيدنا محمد وبارك وسلم. Before we start the actual course material, I want to give you an overview of what we will be covering on this course on Islamic medicine and hijama. You may be wondering why I am not just calling this course a course in Islamic medicine or alternatively a hijama course. And the reason is because I want people to understand that hijama alone is not Islamic medicine. In fact, hijama is a practice that is found in almost every traditional medical system. Islamic medicine is the use of hijama according to Islamic principles, but it is not limited to just the use of hijama. Just as importantly and stressed on in the hadith is the use of other modalities and therapies within Islamic medicine. These include dietary and lifestyle advice, herbal medicine, the application of heat, as well as the observance of specific amal for various physical and metaphysical illnesses. It is important also to know that this is not a course in Unani medicine or Tib or Hikmat, which actually has Greek medicine as its root, as its principles, not Islamic medicine. We don't rely on Greek principles as the root, neither do we borrow from Western medicine for diagnosis and understanding a patient's illness. In fact, this course in Islamic medicine is the first of its kind to be taught by going back to the roots of Islamic medicine principles as found in the Quran and the Hadith, and expounding on these only as the basis for the use of other modalities and therapies. This system then has its own independent system of diagnosis, its own independent system that defines the disease framework and how we derive the treatment principles based on the understanding of the disease. The course itself that I have prepared is divided into 14 modules or sections. The first 7 deal with the theory and application of Islamic medicine and the modalities of hijama, herbal medicine, and dietary therapy based on a person's constitution and presenting illness. The remaining 7 modules discuss the best ways to treat specific illnesses from different categories of clinical medicine, things that you will be seeing daily in your practice, things that people are complaining about. Each disease is discussed in detail, including the specific diagnostic considerations, whether you need to put more emphasis on the pulse or the tongue or a particular question that you may need to ask when you're dealing with a particular condition, etc. Also, I discussed the etiology and pathogenesis, that means the cause of the disease, that how did it come about, because this is essential actually to treating an illness. Very often, if you ask the right questions, you can determine what is it in the patient's environment or in their diet or in their lifestyle that is actually causing the illness. And if you don't address that, you cannot fix that problem with medication. So, etiology and pathogenesis are extremely important, and I discussed that, including the different root causes of the illness, as well as what the best treatment modalities are for that particular illness. You may find at times that hijama is not the best option. At times, maybe no treatment is necessary. And as a practitioner of Islamic medicine, we have to maintain this principle that we only treat when it's necessary. The best and the ideal cure for the patient is if they adjust their own diet and lifestyle and address the root cause of the illness. Yes, hijama, medication, and other modalities that you will learn in this course do have an effect on bringing about a more speedy recovery. But that disease that the patient has come about due to poor lifestyle, due to poor dietary choices, or due to some effect from the environment, which has to be addressed. So in that particular section, I discuss disease by disease and go through these particular issues. You will also be introduced to the range of herbal medicines which I have developed specifically for those who complete this course. And after the course as well, I will be conducting more advanced courses in whatever you are interested in, whether it's gynecology, whether it's specifically conditions like infertility, diabetes, etc. I will also have advanced courses in tongue and pulse diagnosis, as well as moxibustion and heat therapies, laser therapy, etc. So as you can see, the course is quite comprehensive, and if you haven't already, please go to hijamacourse.com, pre-register. Wait for the emails to arrive in your inbox and enroll when the course opens.